So welcome to the show. I'm here with my guest, Dr. Rob Melillo. Thanks for joining me tonight.
Oh, it's my pleasure. Thanks for having me on.
Yeah, how you doing tonight?
I'm doing great. Doing
Great.
great.
So Dr. Melillo, first question I like to ask, and I know you work a lot with children, especially those with developmental disorders. How did you get into this line of work? What drove you to this profession?
Well, early on, when I was younger, I was an athlete, and I had a lot of injuries, especially playing football.
Mm-hmm.
And I had found that my interest was working with athletes at first.
Mm-hmm.
So I had planned on going to medical school, but through my whole life, really, we had a family chiropractor, and he had always been extremely helpful. And in fact, whenever I really had injuries, I went to him. And so I had told him that I wanted to work with athletes, and he kind of said to me, well, why don't you try thinking about chiropractic school? So it actually sounded good to me, and it made sense to me because I wasn't really big into the idea of drugs or things like that. So
Mm-hmm.
I started that, and when I was in there, I realized how neurology was really the basis of chiropractic, and I fell in love with neurology, and I found I had a real aptitude for it.
Yeah.
So my concept when I was graduating with school was to be able to somehow combine sports medicine with neurology, and basically do like a neurological rehab. And so right out of school, I did my diplomate in neurology, which is a 3-year subspecialty. And then I did one in rehab, and I got early on into teaching and research, and really into brain research, and it was pretty exciting. My practice did really well, and it was an exciting time. The early 90s was the decade of the brain, so all this new brain research came out, and that's when they started really coming out with brain imaging, so we could really look at the brain in real time. And the idea of functional connectivity started to emerge, which means that most problems in the brain really revolve around how the brain connects or integrates or doesn't connect or integrate, and not the idea of chemical imbalances or things like that. But then in 1995, I came home one day from a busy day in practice, and I was working predominantly with adults doing, really sophisticated rehab. And there was a woman sitting at my kitchen table with my wife, and she was crying. And I had 3 small children at the time, and I was tired. It was late at night. And she said, this is Denise. She has a son with ADHD and maybe even mild autism. She's tried everything. She started her own, self-help group with 100 parents, and she's looked into every, mainstream approach, and nothing works, and it's only getting worse. And so at that time, I had an office that had I always believed in a multi-specialty approach. So I was very into nutrition and diet, but I had Chinese medicine and acupuncture and massage therapy and traditional medical doctors and physical therapy and occupational therapy. And I had that all in my office. I was the first person in the country to ever do that. So she knew I knew about a lot of different things, and I knew a lot about the brain. So she said, can you help her? She's looking for anything that might help. And I took my wife aside and I said, I know what you're trying to do, but, I don't really even know what ADHD is, and I don't really have time to do this. And she said, this woman's in pain. She's suffering. She has kids. And, I get a feeling like you're supposed to help her in some way.
Mm-hmm.
So not being able to deny my wife, I said, okay, I'll look into it. Coincidentally or not, 2 days later, I had a parent-teacher meeting with my 5-6-year-old son who was in first grade, and the teacher would walk in and she says to me, I don't know how to tell you this, but I think your son has some sort of developmental issue, maybe ADHD or something. He's very bright in some ways, but he can't pay attention, he can't sit down. So now, first I felt kind of embarrassed, right? Here I'm supposed to be an expert on this, and I don't even know what this is. And obviously I didn't see it in my son. And like most parents, I felt like I must be to blame in some way, right? And I felt like, what did I do wrong? And all I knew is that I heard my wife's voice saying, I think you're supposed to do something with this. And I thought, this isn't a coincidence. There's a message here. So all I knew was I was going to try to see what I could do to help. I didn't know if I could. And my first question was, what is it, right? I knew a lot about the brain. I knew a lot about rehab, and I had a very practical approach to things. And I just wanted someone to point me and say, well, ADHD is this problem here in the brain. So I went to people that I thought would know, colleagues of mine, friends of mine, pediatric neurologists, neuropsychologists, neuroscientists, neurologists. And I asked them, what is ADHD? What's happening in the brain? They all looked at me and said, I don't know. I don't know if anybody knows that. So that didn't sound right to me. I'd already been doing research, so I decided to jump in and do it myself. Started spending all my free time at a library and a medical school and trying to research it. I started coming across some really interesting papers. I started to reach out to other researchers who were really doing some cutting-edge research. And, over several years, I really started to emerge and figure out what was happening with this concept of functional connectivity and what was happening in the brain. And then I came across this concept of what's called functional disconnection, which is the idea that there's nothing wrong with the brain, but that different networks, especially between the two hemispheres, don't connect. They don't sync with each other. And there's this lack of integration, and there's this sort of imbalance, because when you read about anything in this area, you read immediately, you hear that many of these kids have what's called an unevenness of skills, where they're really good at certain things, maybe exceptional, maybe even savant level, but then they struggle with other things. So right from the beginning, it sounded like an imbalance, and having a rehab mentality where you're always kind of looking at imbalances, it resonated with me. And so I started, looking into it more, and eventually, came up with this real model of what was actually happening. And I wrote my first textbook, Neurobehavioral Disorders of Childhood: An Evolutionary Perspective, which was all about really looking at the research and putting it together as a universal kind of concept, because it wasn't just about ADHD. This was believed to be the root cause of everything, really: autism, OCD, Tourette's, dyslexia, processing disorders, and not just in kids, but maybe even things like schizophrenia, drug addiction, and other things in adults. So, then my main focus was, okay, what do you do about it? That was how I started, right? Like, what do I do about it? So I started experimenting with different things and concepts in rehab, of really trying to create a balance between the two hemispheres of the brain. And right from the beginning, I started really getting pretty remarkable results. And that really is what started it all. And I remember the first family I worked with a nonverbal autistic child. His name was Dan Costello, and it was probably around 1998 or so. And I hadn't worked with an autistic kid, and the parents came in and they were crying. They had been to a neurologist who told them that they should start looking for an institution for their 3.5-year-old son, because that's where he was going to end up. And they were the same age as me and my wife. The kids were the same age. And, they asked if I could help. And I said, I don't know. I think I have an idea of what it is. I'm getting great results with ADHD and OCD and Tourette's. And they said, well, will you try? So I just started doing some right hemisphere-based stimulation on him, because I know that autism is a right hemisphere deficit. It's a delay in that. And 3.5 weeks later, they came in crying again, because he had just started speaking that morning at breakfast, just spontaneously started speaking.
Awesome.
And they were giving me credit for it. And at that point, I remember they were all hugging me, literally like a pile around me, the kids, the parents. And all I remember is, I don't know if I did this, but I knew that I said to myself, if I did this, this is what I will spend the rest of my life doing and understanding and trying to bring this out so other people can do it. And that's really been where my life has been over the past, 20 years or so.
Awesome. And since then, you now have, multiple books and the Brain Balance Centers, where you're helping thousands of lives every day, I'm sure.
Yeah, we have, eventually when I perfected the model, I started first teaching it to other doctors and physicians and therapists. And since then, I've taught about 10,000 professionals around the world. But I knew that wasn't even enough there needed to be more. So we eventually developed brain balance centers, achievement centers, and we started a company in 2008. And so now we have over 100 centers, and we've worked with 40,000 kids in the past 10 years with well over a 90% success rate. And by success, I mean correcting issues, like eliminating and correcting with objective measurements, things like ADHD and Tourette's and learning disabilities and dyslexia. And I've been in practice also during that time. And in 2009 came out with Disconnected Kids, which is now translated into 15 languages and has sold 500,000 copies around the world. And I get letters every day from people just using the book alone that have really changed their kids' lives. So, it's been pretty rewarding. I also, I've gotten other multiple degrees. I have a degree in neuroscience. I got a degree in rehabilitation, neuropsychology. I'm doing another PhD right now. So, just doing that and teaching and going around the world. And I head up a research lab. So I've published about 50 papers. Our lab has published hundreds, and I have 20 chapters in other textbooks. So it's been pretty active the past 20 years.
Awesome. And so you see a lot of variety of different issues in your brain balance clinics and your personal clinic, I'm sure. What conditions typically have you seen respond really well to these brain-based therapies that you provide?
Well, what I do is what I call developmental functional neurology. So it's not just about kids. It's about the understanding that almost everything in psychology, psychiatry, mental health, education, even in adult mental health, is realized that it really all starts in childhood. They're all developmental. Many of them are believed to start in the womb. But certainly within the first few years of life is when most of them start. Even things like schizophrenia that won't show up until the 20s, we know that studies have shown that looking at videotapes of kids, like if you look at adults that become schizophrenic, if there's a study going back looking at videotapes of them and their siblings and having people that are blinded to it actually look at these videotapes within the first 5 years. And people who have no experience and are blinded can usually pick out who is going to be the one that ends up being schizophrenic by looking at their movement. The motor activity, the motor milestones are off and they look awkward and their movement is off. And that's often the first sign that something is going awry. When a kid doesn't crawl or is walking late, these actually do matter significantly. And when you change that, I believe you can actually change the destiny of the child. And I think that you can prevent these things from happening. So the idea of looking at these things from a developmental perspective and understanding that they're all about these functional connectivity issues, not chemical imbalances or things like that. Most of them are not genetic mutations of some sort, although many of these kids, may have some genetic mutations. The vast majority don't. And so there are these functional imbalances. And the question was, what prevents the brain from connecting? And the idea is that there's what's called a developmental asynchrony, where one side of the brain is the genes are not being turned on as the way they should be. So they're slowed in their development. And when that happens, the other side tends to speed up. And so this developmental problem usually is apparent certainly within the first 6 years, but even usually earlier than that, within the first year, you can kind of see it. And so now we look at almost everything. 1 in 5 kids have some sort of severe mental diagnosis between the age of 5 and 17, and 1 in 5 adults have a diagnosis. So the question is that a coincidence, or are they really the same population? So I work with all of those different types of things in kids and in adults, because really a lot of them start with these postural imbalances and motor imbalances and muscle tone imbalances, and they have motor and coordination, and the brain regulates everything. So if the brain is out of balance and the brain doesn't regulate the autonomic system, then the digestive problem happens, and you end up getting leaky gut, and then you end up getting food sensitivities and inflammation and vitamin and mineral problems. You get malabsorption syndromes, you get hormone imbalances. So virtually everything, autoimmune problems. I mean, if you look at an autistic kid, they have everything. They have autoimmunity, they have eczema, they have food sensitivities, they have chronic inflammation, they have gut problems, they have, as well as obviously social and communication issues and motor problems and sensory processing issues. And so the cool thing for parents, when you look at that, and even with physicians that I teach, it's overwhelming. A kid comes in with all of these symptoms, and they're nonverbal sometimes, so they can't tell you anything. So, how do you figure out where do you start? And when you understand that it's really one core problem, this functional imbalance, and even though the makeup of it is really unique to every child, the basic underlying problem is the same. And so instead of looking at it like, hundreds of things going wrong in your child, you look at it as one problem with many different types of features. But when you deal with that core issue, everything else goes away, which is really, really cool.
Yeah, of course. And I really resonated with something you said earlier with the importance of treating children, is that you have the opportunity to truly change the destiny of, their destiny.
Yeah.
They're at a fork in a road when they come to see you, and you get them better, and you dramatically alter the course of their lives, which I think is super important. So,
and what it does for the family and the parents is, as a parent, that resonates incredibly well. And like you said, you change the trajectory of development at an early age, and 20 years later, it's a whole different life, right?
Absolutely.
And when they're kids, you can do things. They're not going to fight you. And, when they become adults and teenagers, it's hard. It's hard to get them to do dietary changes or do exercises. They can choose not to. And so, getting to them early is really advantageous, although, you really can change this at any point in someone's life.
Absolutely. And so you've obviously had a lot of success thus far in life, but it sounds like you've got a lot of other exciting things in the works.
Yes.
Can you talk about that?
Yeah. I'm very confident that this model that I've created is the model. I think this is the future of healthcare. We will come to realize that the brain is the center of it all, and I think that's starting to happen now, but people are still looking at it more from a biochemical model, with diet, nutrition, and the gut. And it's really much more complex than that, much more dynamic than that. And so the only thing is, developing better and newer tools in which to change the brain and to engage with kids, and especially kids that are, let's say, nonverbal, that are really hard to get them. So one of my students who had studied me when he was in graduate school and kind of became obsessed with my work. He's a very bright guy, and he came out and he wanted to do more. I talk about using, these problems they're what we call epigenetic, which means they're not genetic mutations, but genes are not turned on or turned off because of environmental factors. And that can be many, many different things, but most of them are lifestyle factors like diet, exercise, nutrition, movement, stress, things like that. So the way to change them is by harnessing different environmental factors, by changing diet, by using things like light and sound and music and movement and inner ear stimulation, and using all different types of stimulation. And so I did a lot of research on looking at different frequencies of colors, and like the research is pretty clear that frequencies of light, like red light, affects the left brain and stimulates it, where it inhibits the right, and vice versa. Blue actually stimulates areas on the right side and inhibits the left. So he took all of these things and started to create a software program, because I've also been mostly against the use of video games and addictions that can come from that, because more often than not, most of the problems we see are these right brain deficits like ADHD, autism, OCD, Tourette's, addictive behavior, schizophrenia. And video games target the left brain. So they actually make them worse. And kids that are very good in left brain skills, they tend to love technology and science and math. And so they get literally addicted. And that is the same networks in the brain that are at the basis of addictions, in fact. And in fact, they've called video games like digital heroin. But, they're a reality. And virtual reality is going to be even more addictive than anything else, and augmented realities. So this kid came up with an idea of how to take my work and embed that into video games so that these video games became therapeutic and changed the brain in positive ways. So this is a new area. If your listeners have never heard this, remember they heard it on your show first. Digital medicine or digital therapy or digital drugs is the future. I mean, 5 years from now, you're going to hear it everywhere. And companies that are going to be out there are going to be like the new pharmaceutical companies in a good way. But it's basically like mixing a software company and a pharmaceutical company because, they will be prescribed by doctors. And so we've already created this, and we're one of the leaders right now. There's really one or two companies that have gotten FDA approval in this area. It's a whole new area that the FDA set up. And so we're about to just go for FDA approval in these video games and virtual reality and augmented reality and digital music. And these are initially going to be only used by physicians. Eventually we'll make maybe more widespread things for the consumer. But we're looking at doing an FDA trial for ADHD, autism, bipolar, but also for pain management. We've shown some unbelievable results with we did a pilot study in the UK with burn victims and amputees that were the worst pain patients that they could get. And they had said to us, if you can get a 30% reduction, we definitely want to do another study. Yeah. And we ended up getting like an 80% reduction in like a couple of days. And many of these people put away their drugs and just wanted to use this. So with the opiate crisis, if we can do something like this that would help manage people's pain without taking a drug. Yeah. So these are pretty exciting times. I mean, the people we have developing the software there's only one of the guys, there's only 10 people in the world that have a certain certification in artificial intelligence, and he's one of them. So this is really neat stuff, and we should be starting an FDA trial very shortly with these. But they're already, I already use them in my office, and we already have some physicians, and we're already training people on how to use these tools.
Yeah, that's really exciting. Can you share some examples on maybe some of the examples of the therapies that you've used for maybe the burn victims or other populations?
I just had a family from Australia came last week, and they had a nonverbal 4-year-old kid, and so they had tried everything, and they came, and so now what we're doing is with an autistic kid to get them to just sit there so you can use different therapies is very hard, obviously. And so the first and foremost, the foundation of everything revolves around movement. And there's something called primitive reflexes. These are reflexes that all of us are born with. They start, many of them, in the womb. But things like rooting and sucking reflexes, grasping reflexes, orienting, the Moreau startle response. These are things that as parents, we see them. We don't really know what they mean. And we do know that some of them come back with brain injury later on in life, but they're supposed to all go away by the first year of life. And unless you have a brain injury or spinal cord injury, they should never show up. It started to emerge about 20 years ago in some of the research that many kids with developmental issues, they don't ever go away. Like they're still there, which again signifies that there's this developmental delay in growth and immaturity. And so I really got into that in a very heavy level. And what I've been able to show is that even in many really high functioning adults, they still have some of these primitive reflexes. So getting rid of those and working on muscle tone and working on movement and sensory stimulation and stimulating the underdeveloped side of the brain, that's the foundation of everything we do. But this kid, we're able to not only do some of those activities with him, but then we got him to sit we have a vibration plate that he stood on, and he watched this virtual reality screen. And at the same time, we were using headphones with digital music, and then these eyeglasses that flash light with blue lenses that stimulate in the only going to the right side of the brain, and music that's specific for the right side, and the virtual reality screen with the colors and the movements. And then we were able to put an electrical stim unit on him, which something like this has just been approved by the FDA for ADHD and depression. Mm-hmm. And we were able to get him to stay there for like 15 minutes. And then I'm also using, he could not even sniff. Most kids with autism, they don't sniff and they don't smell anything. Afterwards, we actually got him to smell a bottle of peppermint oil, and he smelled it. And I said, peppermint, and he said peppermint. It was the first word he had ever said. Mm-hmm. Now, that was after only 2 days of actually working with him. Mm-hmm. And he had said a couple other words before he left. So, things like that. I mean, to me, getting a child that doesn't speak to speak, I don't think there's any more important thing that I could do with my life.
Yeah.
And that's where my focus is now. Brain balance, we work with high functioning kids, and we get like huge success in almost every kid with that. But what we don't work with are really adults, and we don't work with nonverbal autistic kids because we're just not set up for that. Mm-hmm. And so that's where my focus is now. That's what I want to devote my life to, the most severe issues, the most difficult problems. And I have people that fly in all over the world to my office in New York every week. I mean, I'm seeing people from Canada this week and from Italy. And they do that because the results we get are just absolutely remarkable.
Yeah, absolutely. And you had mentioned earlier before we started recording about some research at Harvard that really validates your approach, right?
Yeah, the idea of looking at hemispheric imbalances and right and left brain, there's so much misconception and misinformation about there. Mm-hmm. You read on the internet or something, people will say, well, the right and left brain thing is a myth. And it's completely wrong. The idea that the right brain does this and left brain does that is not in itself correct. All areas of the brain are being used when our brain is active, but the hemispheres absolutely do things in a different way. And the way they develop and what they specialize in, that's one of the most well-documented facts in all of neuroscience, that the brain is lateralized and asymmetric. Besides my books, if anybody really wanted to get into this, there's a Dr. Ian McGilchrist, who's a psychiatrist out of the UK, and he has just come out in 2018 with a second edition of his book called The Master and His Emissary, The Divided Brain in the Western World. And it's all references. It's an 800-page book, but it's all about brain asymmetry and how it influences people and how it influences psychiatric conditions. But the thing is, he doesn't have any way to change it, right? Nobody does, except for what I've developed. And so there was a lab at Harvard, at McLean Hospital, which was the #1 mental institution in the United States, and obviously Harvard Medical School. And there's a lab there that's been around for almost 30 years with some of the top researchers in the world, and they focus on ADHD and bipolar and other types of developmental neurological issues. It's called the Lab for Neurobiopsychiatry, Developmental Biopsychiatry. And so I was invited to come speak to them a few years ago. And after I went there, a couple of the researchers had kids with ADHD, and they put them in our brain balance centers, and they saw results that they couldn't believe, because they've been studying everything, every treatment for the last 30 years. And they basically said to me, nothing really works. Medication only works temporarily, and nothing else really makes actual changes to the brain. So they were excited about what I was doing, and so they had a background in also hemispheric integration, and so they've been doing a study for the past couple of years, and they just published a white paper on the preliminary data because it was so exciting. The full paper will be coming out probably in about a month or two, but it's a study that looks at ADHD. It was 15 weeks of a home exercise program based on basically what's in my book, Disconnected Kids. Hemispheric stimulation exercises and primitive reflexes directed towards the right brain. And then something also called the interactive metronome, which is on timing and rhythm and coordination. Mm-hmm. And so this was 15 weeks, and they did a battery of psychological and cognitive tests before and after, but they also did brain imaging with the most cutting-edge brain imaging machine on the planet. There's only 6 of them in the world, and they have one of them, and looking at functional connectivity. And there are 2 different control groups. There's a waiting list control and a normal control. And the bottom line is that they have seen changes in both the neuropsychological and cognitive tests that they never saw before. But more importantly, they saw physical and functional changes in the brain and connectivity changes in the brain that have never been documented with any other intervention to this degree. And what was cool is that it was really the changes were specific to the right brain. And it wasn't just that they were doing exercises, because there was another study that they started at the same time doing the same protocol, and it was a general OT, PT type of exercise program. And they dropped that study in 6 months because they weren't really seeing significant changes. So the idea of the primitive reflexes with the hemisphere-specific stimulation and the metronome, those things are unique. And, these are really, they've actually said this is revolutionary. Like, this is going to change the whole way we look at the brain and how we can intervene in all of these types of issues. So, that just kind of validates everything I've said. We've published research showing that what we do works, but when you get independent verification, at the level of Harvard Medical School and McLean Hospital, it doesn't get much better than that.
Yeah, that's great. Well, I'm excited to read that in a couple months from now.
Well, I can send you the white paper that they already preliminarily put out. It's an 8-page white paper. They were so excited about the early results that they put out a paper just saying, this is what we're seeing, and it's just absolutely incredible. So I could make sure we get that to you so you have that.
Yeah, that would be great. Thank you. Well, we are just about out of time, Dr. Melillo. Did you have any closing remarks that you wanted to leave our listeners or viewers with?
If they want more information, and I think it's always great to get, as much information. I think Disconnected Kids, for my work, is a good place for parents to start. It's also a tool that they can use at home. As I said, tens of thousands of people have used it and have gotten great results. Reason why it's translated into 15 languages at this point. On my website is a whole bunch of other tools, but I also, obviously have my practice in New York City, and also I see patients when I travel. I'm going to be lecturing up in Montreal this weekend, and then I'm starting a course, a course for certification course for all these things that I've talked about in Atlanta at Life University. Okay. But if they go to my website, drrobertmelillo.com, I also have just come out with an adult online ADHD brain balance type of course and program that also getting great success with. And it's pretty inexpensive. I get the question all the time, does this work with adults? And the answer is, of course, yes, it does, if they're motivated and willing to do it. But adults are different. We're busy. We don't want to go to an office. We don't want to have to go to treatment 3 times a week or whatever. So I created this online program that's also educational and gives you all the tools at home to do this. So if you know somebody that has an issue, you may want them to check this out. And, it's something I think will be really, really helpful. And I do also have my own line of vitamins that we've created called Kid Genius, which are specific right brain, left brain, and gut types of vitamins that are really low cost, but really are very, very high quality. And we're coming out with an adult line called True Genius very shortly.
Okay. Very good. Very good. Well, thank you again for coming on today. It's been my pleasure to host you. This was a lot of great information. I think people are going to get a lot out of this.
I think so too. I think, for a lot of people, this is probably very new information. I think most people are told that, there's nothing you can do to actually create any significant long-term changes in these issues, that these are things you just have to live with and deal with and learn to manage. And anybody that's had kids with these issues, that there's no good way to manage these things long-term. You can, but it's not, it's not the optimum. And I'm here to tell people that these problems can completely go away, and that most of the kids and adults that I've worked with throughout my career that get these issues, it's because they're actually gifted on one side of the brain or the other. And they're extremely bright. And when you can restore balance, you get these phenomenal, and most of the parents know it. I mean, the greatest compliment I get is when they say, "You gave me the child that I always knew was there, that couldn't get out." And, there's nothing better than that. So, it's a message of hope. Don't listen to people that tell you that you can't do anything, that, do research and go out there. But, I think my program and my work is probably going to be one of the best things they can look at.
Yeah. Beautifully said. Beautifully said. Well, thank you again. And this has been your host, Dr. Kopis, from the Neuro Wellness Podcast, and my guest, Dr. Melillo. Be well.